Good afternoon, and welcome to this webinar, Safety in the Age of Uncertainty and Radical Change. This event, brought to you by ISHN, is sponsored by All-Star. I'm your moderator, Benita Mehta, editor of ISHN. Thanks for joining us. Today's presenters are Brian Galonick and Dr. Tyler Amell. Brian is a certified professional of incentive management and the president of All-Star Incentive Marketing, a 45-year-old company that focuses on improving the safety and health of workers by first improving employee engagement. He's a member of the Incentive Marketing Association and other strategic industry groups and a board member of the Incentive Foundation. Dr. Tyler Amell is an internationally recognized thought leader on the topic of workplace health and productivity. He is Chief Medical Officer and Chief Relationship Officer at Core Health Technologies. He also serves on the Executive Board of Directors of the Work Wellness Institute and the National Wellness Institute. Don't forget to submit your questions, and later in the program, our presenters will address as many as possible. Today's event is being recorded and archived on www.ishn.com. And now I'll turn it over to today's first presenter, Brian Galonick.
Thank you, Benita. I really appreciate the introduction and welcome everybody. It's a very highly attended event. There's hundreds of people registered today. Tells us that there's a hunger for this information out there, which is great, and look forward to presenting it and hopefully answering any questions you might have along the way. So, safety in the age of uncertainty and radical change. This is the situation we're in right now, but a situation we find ourselves in very frequently. This is the agenda. I won't read through it because we'll go through it, but let me just tell you up front that for those in attendance here, please ask any questions through the chat box if you can, or make comments, give feedback, even if you disagree with a point that myself or Dr. Amell have made. At the end of the presentation, I'm going to give an award. Well, not at the end of the presentation, but after the presentation, I'm going to give an award to anybody who's produced the best comment, feedback, or question along the way. That award will be Maui Jim sunglasses, or Bose Bluetooth speaker, or DeWalt tool set. Omaha Steak packages, take your pick. Whoever wins the award will have their choice from a rewards platform. And I do that because I just want you to stay engaged and pass along any comments you have for exactly that reason. We want to be able to give you good targeted feedback. And even though it's a one-way conversation, the second half of that can come from your participation through the chat bot. So the first thing I wanted to highlight, and I'm not going to spend a ton of time on these first three slides because I'll be telling you what you already know, but what I want to highlight is that change is constant, okay? So if you've been a safety professional for the last 10 years, you've seen pandemics, including this one. This one obviously is far worse than anything we've ever seen before, or at least in our lifetimes, or perhaps even thought was possible, and yet it's not even as bad as some people say it could get. But we've also seen Zika and Triple E. For those not familiar, Triple E is Eastern Equine Encephalitis, which hits us Northeast states and is particularly bad. It comes from mosquitoes and it's deadly. And just the last year alone, all nighttime events, including Friday night football games in high schools and everything else, had to be canceled because of that. And while that isn't work related specifically, although it is partially, there's just disruptions. And we see them all the time. And some of them are awful and terrible, right? Climate change leading to natural disasters like Superstorm Sandy, which devastated New Jersey, New York, and other places, or man-made Deepwater Horizon explosions, right? Which set the entire oil industry on its head, I'm sure, for a long time, and all those industries that feed off of that industry, right? You also have the widespread use of smartphones. Certainly in the last 10 years, they go back further than that, but the fact that they are now our lives has changed more recently. And you have, again, negative things, mass shootings, positive things, sort of robotics coming into the workplace, not just in the making of cars, but in regular everyday tasks. And how does that affect your workforce, and how does that affect your daily life? Okay, it's not just the disasters, it's also the disruptions that come from technologies. And so as safety and HR and operations professionals, and that's the bulk of who's on the call here today, we are faced with these challenges all the time. As it says on screen, ride sharing, house sharing, job sharing, the gig economy, all of these things are thrown at us, and all of them present new challenges, and we have to decide how to deal with them. And if you want to go back 20 years, if you've been around for 20 years doing this, you saw, stop me if you've heard this, epidemics before: SARS, Ebola, swine flu, again, climate change, the Tennessee ash spill, Hurricane Katrina, natural man-made disasters, financial collapse, 9/11, right? I mean, how much did that affect all of our lives? in our professions and our workers. And of course, any number of other things like, again, if you go back far enough, you could smoke anywhere, including airplanes. It's almost impossible to imagine the removal of smoking from public areas, the arrival of social media, which has rewritten the script for all of us, and how our workers use it and how we use it on the good side and how it can be used on the bad side. And if you want to go back 30 years or more, and that's certainly the category I fall into, we had, again, epidemics, HIV, AIDS. Again, if you were around in the 80s and 90s, you know how incredibly devastating that was and how scary it was and how much companies had to deal with policy changes to deal with it at the time, especially during the worst of the unknowns and very much the climate we're in right now, right? We have this coronavirus situation. There are the known knowns and then there's the unknown knowns, right? There's these things out there that we're just not sure about. Testing. Do I scan with thermometers the foreheads of every employee as they come back to work? How would I keep my employees motivated when they're working from home? How do I keep those on the front lines from feeling like they're the ones being, put in harm's way? And so, again, going back 30 years, you also had other disasters, the Northridge earthquake, devastating, the Exxon Valdez, devastating, Oklahoma City, domestic terrorism. All of these things have happened and will continue to happen, right? And so going forward for the next 10 years, what could we expect? I hate to say it, but it's true. More pandemics, war, terrorism, and natural disasters. I mean, life is wonderful and I'm an eternal optimist, but there are these moments in time that give you pause and challenge you. There have been financial, collapses of the past, and there's another one. I think most economists would tell you there's probably something big on the horizon here in the next 10 years. Maybe we're in it right now. We don't know. How is that going to affect your budget, your personnel, your work levels, your ability to get people on the same page as it relates to safety and wellness and health related matters, right? And so you have an older workforce. Again, how does that factor in? Certainly people working well into their 70s and beyond now, people working remotely. And how do we manage that better? Increases in renewable energies and decreases in fossil fuels. And as I say there, maybe, because fossil fuel usage is still projected to go up until such time as the others can really kick in. So the disruptions of the past will be the disruptions of the future. It's not a question of whether or not there's going to be a 10-year period where we don't have to deal with the calamity that comes from sudden disasters or that comes from slow things that come in slowly, but then eventually change over a period of time. On the previous slide, I brought up the fax machine. And I don't know how that relates to anything except that when I started my job, there was no fax machine. Then the fax machine came into existence and was a revelation, even with that curled up paper that it kicked out. And here we are 30 years later, and there's no fax machine again to speak of, and no need for one, right? So technologies come and go. The question is, how well can you use them while they're there? The widespread use of drones, it may seem like it's getting widespread now. This is nothing. I think anybody on the phone would realize that in the next 10 or 20 years, there's going to be all kinds of additional things flying above our heads, delivering packages, taking pictures, doing surveillance. And some of that could be great. If you work in the lumber industry and you have to survey the forest to figure out where you want to cut next, it can probably save accidents, injuries, and lives by stopping the need to put men out there to do that initially. And of course, it also involves the lack of privacy and other things that are related to company-wide policy. So change is constant, change is here to stay. And the question is, what do we do about it? So this is not a session on change management. If you've seen before, I'm sure you have, there are entire sessions built around change management and how to deal with that. But these are the basic principles of change management on the screen here. We're not going to go through them, but I'm going to come back to them along the way and just talk about how the central component of what we want to talk about, employee engagement and culture, okay, lead to your ability, an improved ability to handle change along the way. So diagnosing the problem is part of change management. First of all, we have to know what the issue is. With COVID, we know what the issue is, but what are the underlying smaller issues that come out of it? There's some employees that are afraid to come to work, others that feel like they've been left out on the front lines, what have you. Lead with culture. You have to have a good culture. Well, you don't have to have a good culture. Your culture is going to be out front anyway. The question is your culture in such a place that you can actually more effectively deal with a challenge, or is it in a place where you're going to struggle to deal with it because you never really built the culture you wanted to begin with, right? Start at the top. Obviously, you need senior level management on board with whatever the plan is. Involve every layer. You need every layer of management along the way to be bought into this as well. Provide clear instructions, transparent communications, training reinforcement. These are the things that most people will tell you are core to change management, whether it's, again, dealing with a disaster or the new technology that might help you or hurt you. And And communication, as the emergency preparedness people will tell you, communication is the most important part of being prepared for and reacting to emergencies, and engagement is the key to communication. So again, we come back to a familiar theme, and some of you may have actually seen some of my previous presentations, and thank you for coming back if you have, but it all starts with engagement. Every one of those problems or potential problems or situations is symptomatic, if you can't deal with it in a good way, is symptomatic of poor engagement. And again, particularly in the last 10 years, and particularly because of people like myself and Dr. Amel who are out there talking about this, this is the root, the root foundation of what can go wrong and what can go right. How highly engaged is your workforce, right? So many of you have probably seen the Gallup study. This is the state of the global workplace, state of the global workplace. State of the American workplace tells the same story, slightly different numbers, but very much in line. And it boils down to this. You need to be among the top 25% most engaged companies in your space, okay? You want to be even higher than that if you can. Certainly you want to be in the top 10% if you can. But if you're in that top 25% and you compare yourself to a company that's in the bottom 25%, you get what you see on screen here. Okay, this is amalgamated across many different industries, and tons of data, tens of thousands of surveys run for many, many years now, okay? If you're in that top 10%, you have higher productivity, higher sales, higher profitability, okay, better customer retention. If you're in that top 25%, the flip side of the columns you see on the right, you have lower turnover, or put differently, the companies in the bottom 25% of an engaged population, this isn't the bottom 25% of how good your training programs are. This isn't in the bottom 25% of how good you are at hiring people specifically, or any of those other sub metrics. This is just if your employees on average are in the bottom 25% as a company, as compared with your industry, you have far higher turnover. You have far higher shrinkage. You have far more quality defects. You have far more safety incidents. In this case, in a global study, it says 70% more in the area of safety incidents for companies that are in that bottom 25% as opposed to the top 25%. Okay. In the United States, it's not that high, but it's still ridiculously high. And so, and absenteeism and what have you. So it simply boils down to this, right? Managers account for at least 70% of the variance in team engagement. Their own experience with your company can affect your entire workforce. So you heard the expression, employees don't leave companies, they leave managers. For an employee on the job, their daily life isn't about the corporate, building that's located someplace else, or any other job site, or the thousands or tens of thousands of employees in the company they don't interact with. Their decisiveness about whether or not they work for a company that is engaging, that drives their engagement levels, that cares about them as a person, really boils down to their relationship with their coworkers, and in particular, the relationship with the manager. And how well equipped are your managers, okay, in terms of driving culture, how well equipped are they at making sure that they have a highly engaged workforce? That's where this all begins. Okay, so we're going to run two surveys throughout the course of the presentation. The first one's up on screen. Please start answering as soon as you read the question. What percentage of your employees do you think are engaged at work? Okay, as soon as I get enough respondents here, I'll push the results out, and you can feed off that relative to your fellow safety, HR, and operations professionals that are also on the line here, and just see where they think this falls. This is a very esoteric question, I grant you. This is strictly your opinion. Whether you've worked there for 6 months or 20 years, you have some idea of how your workforce reacts and how they handle the requests made by corporate and management. And using that information, I would just say to you, how engaged do you think they are? And thank you. I see the answers pouring in. Drag my feet for one more second to let the last few people come in, just so I want it to be as statistically significant as it can be. And I guess we'll draw a line in the sand right there and push the results. So here's how you answered the question, okay? 33% of your number one category say 60 to 80%, 60 to 79% of your workforce is engaged, followed second place by 40 to 60%, and you can see the rest. For the 4% that are saying that, that it's below 20%, 4% of you that answered that question, clearly you recognize a major disaster, and same for those in the 20 to 39. But here's the reality of the situation. So the average answer here obviously is in the 60 to 80% range. If I were to average it out, maybe it's just in the low 60s, call it 2/3. Okay, you think on average the people on the call think about 2/3 of their workforce are engaged at work. Here's what the study shows, the study that Gallup of the State of the American Workplace and of the global workforce, okay? And these numbers, by the way, have gotten better in recent years, but they still tell a different story, sort of the flip side of what we just looked at for the results of our survey for the people online here. And there are hundreds of you, so it's a statistically significant number. Gallup will tell you that 34% of U.S. workers are engaged at work. Call it a third, okay? About 53% fall in that middle category. They're not engaged. Doesn't mean they're bad workers. They're just not that engaged. And about 13% fall into the fire them tomorrow category. They're actively disengaged. They're disgruntled. They're hurting your workforce, and you're really not going to get a message through to them. So, and if you can see and read that graph below there, what you'll see below is the small line at the bottom is the global workforce, which trends well below the United States, which is definitely on the leading edge of understanding this and knowing why it matters. The green line in the middle is the U.S. workforce, and I'll talk about the one that's slanting up here in a second. But that green line in the middle shows the improvement in the last few years. If you go back to 2000, it's 26%. Currently, it's 34%. And you can see just in the last 5 or 6 years, it's gone up from 30 to 34%. I think it's largely because of this, not me specifically, but people like myself and people like those on the phone, the HR managers and safety managers who get it. If it's already gotten through to you, okay, it's not this, that, or the other thing. It's engagement first, and then we can do all these other things we want to do. Okay, our safety meetings are useless if nobody shows up, or they're equally useless if people show up, but they're not engaged in the meeting. Okay, and they're not retaining what's being told to them. So it starts with engagement, and this is where that story is told. You know, and the old rule of thumb is 20-60-20, that your middle 60% is where you can do anything, where you can really move the needle, whether it's in sales, whether it's in customer service or employee engagement. So you got that middle group, 53% represented on the slide here. That group in particular, along with the 34%, and maybe in some small way the 13%, can be nudged forward in the right direction, but we have to know how to get to them. And what that green bar on the top there is showing, going from 42 to 70%, is that companies that implement best practices to get their employees more highly engaged have been able to go, albeit over a period of about a decade, from a 42% engagement level up to a 70% engagement level. Okay, huge improvement measured over a lengthy period of time. And one last note there, and I do entire presentations on this, but millennials are now the biggest part of the workforce. 10,000 baby boomers retire every day. They're being replaced by millennials and now actually Gen Z or whatever comes next. And the younger the workforce, the more likely they're to be disengaged or disinterested, because they're more likely to be job jumpers and less likely to be loyal to one company. That could easily change, obviously, given the 30 million unemployed right now. But we hope, I'm sure you do as well, that this is more of a V-shaped recovery, and most people are going to get back to work and our lives will come back to normal. But hope isn't a strategy, engagement is. So going back, reflecting back on that 53% or that middle 60%, if you will, sure, you have some people that are naturally, intrinsically motivated. They get out of bed in the morning, they have their feet at the floor, and they are all in. They know exactly what they want to do, and they're going to go at it in a great way. And honestly, you don't necessarily need to give them any more than you already do to keep them engaged, but a pat on the back works for them as well. You have that middle group that is, not highly engaged, but nevertheless not bad employees. You can capture their attention, okay, with recognition and rewards along the way. You can build muscle memory by getting them engaged, by giving them the recognition, and in some cases rewards, to thank them for going above and beyond, for making a safety suggestion, for reporting a near miss, for being a star performer in the company's wellness program, or for being a wellness champion in their location. Every wellness program needs wellness champions to go out and try to recruit other people to get into the stepping competition or join the smoking cessation program or lose weight in the weight loss program. Those people who raise their hand to be champions on the safety and wellness side, those people who volunteer to be part of a safety committee, make the suggestions, mentor the new employees, that group of people can be broadened from however big it is now. It can be made much bigger, and it can be built up over a sustainable period of time by offering up the right recognition. And what you get as a result from your naturally intrinsically motivated and those that are driven to be more motivated through the use of recognition and reward programs is a better and better culture, for which you will benefit in every way I've highlighted so far in the program, up to and including profitability. And with that introduction to the sort of the entire presentation, what we're going to talk about here today, I'm now going to hand it over to Dr. Amel, who's going to drill down deeper on the wellness side of this thing. and really talk about how wellness is one of those engaging platforms for which we can build out the better culture we're looking for.
Thank you very much, Brian. Really appreciate the opportunity to join the group here today to talk about health and productivity and wellness and well-being. And as it relates to the notions of safety and, of course, incentives and culture engagement and all those fun topics that tend to be top of mind, particularly right now, is in many cases we're dealing with skeleton workforces. We're dealing with, low number of people who are deemed essential workers, and we've got a large number of people working remotely. Of course, this has never been more important simply because you don't have that day-to-day interaction at the same level. People are using video such as we're using right now, or telephonically reaching out to people, and you don't necessarily have that camaraderie, that coffee break approach, and all these sort of things that we know are quite important towards supporting cultural aspects in the workplace. So I'm going to touch a little bit on the relationship between these entities and health, and what we can learn and how we can drive better results by incorporating the relationship between health, productivity, and engagement within our discussions. So with that being said, one of the most important questions that I get regularly is, how and who is the relationship between all the disparate things that can impact our health? How are those sort of things described? What does the science say? What does the healthcare literature say in this sense? And this is a fundamental question. There's actually a whole branch of the healthcare literature that's devoted towards something called the determinants of health. Now, hopefully it shouldn't come as any surprise to you whatsoever that the overwhelming majority, so upwards of 36% of your health, collectively speaking, is actually determined by your own individual behaviors and the decisions that you make. So these are decisions such as, taking the stairs instead of an elevator. When you're out and about, parking far away and adding steps, choosing to have, a meal that has vegetables included, snacking on fruits instead of other snacking materials that could be processed or high in sugar, and all these sorts of things. So these sort of behaviors are actually the single largest contributor of your own health, and it actually has a distinct relationship to various other disease conditions that can happen down the line. So items such as, social circumstances, your genetics and your biology, the medical care that you have access to, as well as your environment, aren't as important single contributors as your own individual decisions. And this is particularly important for employers to consider because, when you look at, our approaches to health and productivity, and even through the safety lens or the well-being lens, we know that the decisions that people make in the absence of control measures in place, could impact their own personal safety and possibly result in an injury or an illness. And so, when we look at the broader sense, whereby we're combining a total health approach, such as including investments in well-being to sort of drive down the risk profile of individuals and tackle things such as chronic disease and various other factors that do have an impact on absenteeism, on presenteeism, on healthcare spend, short-term disability, long-term disability, pharmacy spend, always a big topic for folks to take a look at. When we look at the relationship or an interrelationship between all of these factors, we come to the realization that, without a holistic approach that's tying health and engagement and productivity into one another, you're probably missing out on an opportunity there to make a profound impact on your culture and your workplace. Now, these data on the screen right now come from IBI, which is the Integrated Benefits Institute. So this is a San Francisco-based organization. I used to sit on the board of directors. And basically, they have what's called a full cost estimator, which helps employers really get a handle on their own individual cost, as well as benchmarking capabilities against other entities within their own sector. So, for example, if you're in the healthcare space, or you're in the trucking space, or perhaps even education, you can benchmark, to the point where you actually get down into granularity related to regional numbers to show where your absenteeism or your presenteeism numbers are at in regards to others. So, presenteeism in this case is really defined as people who are present in the workplace, but not necessarily producing to the best of their ability due to a health-related issue. So an example of this could be, somebody who's engaged in work is showing up, but is perhaps predisposed or focused on other aspects. So perhaps they have a counseling appointment coming up. Perhaps they have a teenager at home who's misbehaving. Perhaps there's relationship issues. Perhaps there's a diagnostic test that they're waiting on the results of. So all these sort of things can impact the level of presenteeism, which basically shows that people, even though they are necessarily engaged in getting work done, at the end of the day, there could be a significant hit to the productivity. And so we do have measurements and scales in place to estimate these. Typically speaking, if you want to estimate your presenteeism value, you can take your absenteeism numbers and multiply them by 5% if you want to be conservative. I've seen estimates as 7.5 times and as much as 10 times your absenteeism numbers. Presenteeism is a little bit difficult to measure directly, and you can infer it through engagement and a few other things. But at the end of the day, it is quite a useful metric, because we know it does have a significant impact on the cost drivers that organizations are looking at. So in terms of the U.S. economy, I believe these are annual numbers. So we're looking at 941 million absence days within the U.S. economy, about $545 billion in terms of cost of absenteeism and presenteeism. So these are extremely large numbers. 536 million days lost, and most interestingly, from an IBI full cost estimator perspective, is that for every dollar invested, you're essentially losing 61 cents due to illness and injury. So this is extremely useful information. If you're not familiar with IBI, I highly encourage you to look them up. It's a not-for-profit. Employers can join for free and benchmark data, and it's definitely worth the effort, because it does provide some great benchmarking data that is useful, because they've got reference to about 50 million or so U.S. employees. Now, from a disease perspective, I alluded to the fact earlier on that, investing in health and productivity prevention measures can drive down rates of chronic disease, which we know impact absenteeism. They impact healthcare costs. They impact presenteeism. Now, these are some of the hard numbers that I use. So these are data from the Centers for Disease Control and Prevention, as well as MNOs. So when we're looking at these health conditions from a prevention perspective, 80% of all instances of heart disease are in fact preventable through changes in disease management activities, focusing on exercise, diet, sleep, alcohol consumption, and so on and so forth. 80% of type 2 diabetes instances are in fact preventable, 40% of all cancers, and 38% of instances of depression. Now, it's going to be quite interesting to see how things play out with regards to the current pandemic around the coronavirus and COVID-19 disease, simply because, we are seeing anxiety levels that are quite high. We're seeing high stress levels. We know that there is a relationship between stress, anxiety, and, of course, depression down the line if there aren't mitigation strategies put into place to help folks. We're seeing these sort of things crop up now. So it's quite important, to reach out to do behavioral health resources, helping people adjust to working remotely, helping people to adjust wherever possible to drive down that overall risk profile. Now, one of the ways in which I tend to look at health and productivity is through a lens that basically touches on all aspects of the environment that people work in. So we have investments in health and productivity in terms of disease management, well-being programs, engagement, PTO programs, all these sort of things. Now, they're all linked to other aspects. The benefits can be broadly encompassing with regards to the pharmacy spend, as well as, dental benefits, all these sort of things. They all come part and parcel with regards to how organizations treat and support their employees. Now, COVID has obviously changed a lot of things with regards to how these sort of things are being administered and accessed. So there's a huge spike in virtual care as of late. So, we've been talking about the adoption of virtual healthcare services for a long time. We've had the technology. Technology wasn't a limiter. There were some funding codes and there's a few other things sort of holding it back. But people, by and large, we're still interacting with one another physically, live and in person. And so having access to different types of care and different types of solutions, not just focused on the psychological health side, but for even delivery of overall healthcare, has really changed things. And of course, that does have great potential for reducing the impact on productivity. Colleagues of mine did a study years ago that showed that up to 80% of all medical visits can actually be done remotely, because you don't actually need to see the patient to be able to lay your hands on that patient. It's not actually a requirement in the overwhelming majority of instances. So this is something that I think is going to have profound implications for us going forward. Now, of course, from an environmental health and safety and a peer health and safety approach, we have primary, secondary, and tertiary initiatives that we put in place. So primary prevention is, of course, engineering controls, reworking work so that you're reducing the overall risk profile. Secondary prevention is related to detecting of injuries and diseases in asymptomatic populations. And tertiary prevention is very much focused on work disability management activities. So these are things like short-term disability, long-term disability, even FMLA administration for casual or intermittent or chronic diseases or chronic conditions. And these all have a distinct relationship between or supporting of culture and engagement. So this is quite important to highlight, because a lot of people treat these sort of approaches in silo. So they don't necessarily think of an OH&S program as the same thing as their overall approach to health and strategy. Whereas, if you look at things from a holistic sense, the health of your workforce is extremely important. And it can't just be related to how you choose to define things with regards to how your benefit plans are set up or how things are administered locally. There has to be some interconnectedness there so that you can help get the best impact and the most significant impact upon operations and moving things forward. Now, from a connection perspective, with regards to tying it back to what Brian was talking about earlier, I'm a very firm believer, and in fact, there is a fair bit of research out there that demonstrates that you cannot have productivity and you cannot have engagement if you don't have health. Now, it's quite simple. Prior to COVID-19, I would travel the world and speak at events. And I check in and out of hotels an awful lot. I could tell an engaged employee from a disengaged employee quite easily based upon the fact that I know the script that they're supposed to go through whenever they check me into the hotel. Now, when we talk about engagement, usually this is the amount of discretionary effort that people give. So if you think about, a coworker who goes above and beyond all the time, well, that's an engaged worker versus somebody who's working to the limits, doesn't necessarily, go above and beyond at all times or even sometimes. And so that's really what those Gallup studies, what we're looking at, and how you actually define that sort of thing is quite important. And of course, the measurement and combining that relationship between health, engagement, productivity is of course important. Now, on the productivity side, this is an interesting one because, it's really the lowest hanging fruit. Our approaches to absence leave and disability and in keeping people engaged in the workplace is something that's quite profound. And making that linkage and being able to sort of address the lowest hanging fruit in this sense is quite important because, health and engagement are influencing your ability to produce a discretionary effort. And of course, on the engagement side, health is definitely related. Our minds, bodies, and performance are ultimately linked to one another. So I firmly believe that these three concepts are in fact quite highly related with one another. And if an organization is serious about making an impact in these particular areas, you have to think of them as a collective. Now, one of the questions I get frequently from employers is the question of, how do we set aside money for this? Is there really a return on investment? How can we address this beyond the traditional value on investment discussion? And so, which means moving it into a return on investment. Well, this is a study that was published a couple of years ago in the American College of Occupational and Environmental Medicine's journal. It was done by Ron Gatzel and a few of his colleagues. And what they did was they compared the stock performance against people who won an award versus those who didn't win an award. So in this particular case, it was a 15-year period. And the award that they chose is called the C. Everett Koop Award. So C. Everett Koop is a former Surgeon General of the United States. And he has this award named for him. And it's basically designed to recognize organizations that really invest in health and productivity solutions. So they invest in engagement, they invest in incentives, they invest in overall approaches to really help show the love for their population, and for all the reasons that Brian talked about earlier with regards to the to the Gallup studies around, reducing turnover, reducing overall spend, and so on and so forth. So the major outcome from this particular study was that the organizations that won the award had a 325% increase in their stock value over that 15-year period versus everybody else in the S&P 500 who didn't have won that award. So this is quite important and it's quite meaningful. And, I apologize to the toxicologists out there who routinely get published in this particular journal. But at the end of the day, this is probably the most important research paper that I saw come out of that journal in that year, because it did give an awful lot of credence and support to organizations looking for ammunition to have discussions with their chief financial officers around investing in the health of their workforce. Now, this concept of ROI is something that is studied quite readily. Whenever I'm consulting to organizations and I've been invited to speak to them, I've been in the room in many organizations as consultants are in to talk about various different types of investments and vendors around primary prevention, secondary prevention, tertiary prevention, and these sort of things. And I see some rather outrageous claims on savings. I'm not a big fan of those because I tend to be much more evidence-based and evidence-informed and want to see that the research and the literature that'll demonstrate that, yes, these things do, in fact, carry this amount of weight. I've seen numbers of, 8, 10, 12, 15 times your return on investment with regards to the amount of money that you would put in. Now, the way I like to look at this is you could flip this on its side. If you were to go to an investment conference and then somebody were to say, you know what, if you invest in this mutual fund or this basket of stocks or something like that, and we're going to guarantee you a 15 times return, you're probably going to think that person is out to lunch and not necessarily in tune with reality. And in fact, it's very much the case that we see in the health and productivity space as well. All the numbers that you're seeing on the screen right now are in fact below a 4-to-1 return, which are significantly below what you tend to see out there in the gray literature. But these are large-scale studies that actually have demonstrable value for organizations looking to ascertain what their true return on investment is going to be. As far as I'm concerned, knowing the relationship between health and productivity and engagement, even if you're getting results the same as lifestyle management at 0.5 to 1, that is still a net positive when you consider the benefits of the engagement aspect and the productivity side as well from the work disability side. So again, quite important values out there do exist to help support your investments in the relationship between health, productivity, and engagement. So in terms of a summary, before I pass it back over to Brian, looking at the concept that work is fundamentally good for us is quite important. Now, the opposite to that is in fact true as well. Not working maybe even work for us. So it is quite worse for us from a couple of different perspectives. We're social animals. We're social creatures. We need to have that. We've got 30 million people out of work right now in the U.S. Hopefully, as Brian mentioned, we'll have a V-shaped recovery, and a lot of those people who will move off of furlough or return to work quite readily. But, some of them may not. And so this has profound implications for their own health, as well as for the overall health of the economy, and of course for the organizations that they were part of. Now, one of the things that I tend to look at as well is the concept of integrating these sort of activities into what's called work disability. Now, from this perspective, our approach is typically to keep that level of engagement between workers and the workplace, even if they are sick or even if they are ill, because it's better for them and it's better for the organization in many respects. And I'll end with a quote, and this is from Richard Pimentel, who's a very well-known work disability advocate. He's been quoted as saying, you don't get ill workers back to work, you don't put ill workers You don't get ill workers well to put them back to work. You put them back to work to get them well. I apologize, a little bit of tongue-tie. This is my third webinar today, so things are blurring together for me. It's quite an interesting approach. And, the message there is that stay-at-work activities are very much worth the effort on behalf of organizations. Return to work when you must, but stay at work is probably the most strategic approach that you can take from that perspective. So I will pause there and turn it back over to Brian, who's going to continue with the discussion. Thank you.
Thank you, Dr. Amel. Appreciate the great insights, and we're going to come back to some of that in the next part of the discussion here, where we tie together safety and wellness. Hopefully everybody can see the next survey on screen. And again, we're just going to give you some feedback and let you know how those of you on the line here view their existing wellness program. You can read the question for yourself. It sort of presupposes you have a wellness program, but one of the answers is I don't have one. So I don't have a wellness program. And if you do have a wellness program, how do you rate it from highly to somewhat effective, or highly or somewhat very ineffective, or right down the middle, effective? And we'll tell you why, I think it'd be abundantly clear why we're asking this question here in a minute, and why, frankly, it's an important part of the entire presentation, a presentation built around the idea of safety in a time of uncertainty, and how it all matters, but coming back to that employee engagement piece of this. So see the answers rolling in. I'm going to give it just another second or two. So if you're about to click, go for it. All right. Then I'll push those results. And actually, before I do, two quick mentions. First of all, while Dr. Mel was talking, I had a chance to look at the questions that were coming in and the comments that were coming in. They're great. We're going to have some good questions that we'll do here in the last 5 minutes of the webinar. And I think you'll feed off the answers. And my other comment is that, because there are some questions coming in about PPE use and access and what have you, total aside note, if you're on the line and you need access to PPE, there's a flood of it available right now in my industry, in the distributors we work with. And so masks and anything along those lines, sanitizers, got tons of it. If you're in need of it, let me know. I'd be happy to help you out. Okay, so here's how we answered the question about wellness program. For starters, 22% don't have one. And I would just offer that up initially as just a missed opportunity. Now, not having one and having a very ineffective one, which thankfully only 4% feel they have, is about the same thing, or maybe even having a very ineffective one is worse. If you hang a poster on the wall and it tells you the 4 basic food groups or 3 basic food groups, you don't have a wellness program, right? So to have a real program, and one that can be used effectively, you need to put some meat behind it, and it needs to be sustainable. And that's the mention I had earlier about wellness champions, right? Even a really well-built program can't be launched and ignored. It has to be massaged along the way. So for those that say they have a effective or highly effective or somewhat effective program, that's great. My guess is you would also admit that could become even better with the right kind of support behind it. But the fact that you already have one and then it's good, or at least in decent shape, is a great thing to build off of for safety. It's great to build off of for wellness as well, but it's a great thing to build off of for safety, because the wellness programs and other components of your safety program, like training and what have you, these are the engagement opportunities. Okay, there are others, but these are a couple of the most important engagement opportunities. And so using your wellness and safety, right? Flip sides of the same coin. They're totally interdependent. And the next couple of slides kind of hit that point. But sleep apnea, right? Obesity leads to sleep apnea. Sleep apnea leads to tired driving. Tired driving leads to accidents and God knows how many other problems. And some stats there about how much sugar we ingest, and how 25% of Americans don't exercise at all. My only exercise, I have to admit, comes from playing hockey, the occasional bike ride. I could probably use more. But the idea that people do no exercise at all is particularly dangerous. And you can imagine why. But forget about just caring about your employees. Forget about wanting to be healthy. How about the fact that if they're driving for you, and it doesn't have to be a truck, it could be a forklift or a pallet jack, and they're tired on the job because they don't sleep well, because they're obese and they're not doing anything to get better about it, or the fact that your type 2 diabetics are going to have a hard time getting their class 2 driver's license renewed. These things cost money, cost injuries and lives, and so very tied together. Another obvious example, stress. There are now doctors out there that will write employees a note basically saying that, John doesn't have to come to work today suffering from high levels of stress. Our fathers and grandfathers would find that baffling, right? Everybody has a certain amount of stress in life, but the truth is stress is a real thing. Stress, especially experienced at a high level, and if you don't know how to deal with it, is going to lower your immune system, make you more sick. High blood pressure and the things that go with it can lead to distracted driving, poor decision making. Again, these are safety related issues. So, it's not my problem side of the way we think, all of us probably think, is fine. I mean, to a certain extent, we don't want the nanny state, but at the same time, you care about your workers, you care about their safety, you care about their performance and the overall success of the company, and stress is debilitating and is very much a safety issue. It's a wellness issue and it's a safety issue, and a properly built wellness program can help your employees with hypertension, with high blood pressure, with stress-related issues, and it can benefit safety as well. Smoking and tobacco as a whole, and actually, as I look at this picture in the background, I doubt that guy's smoking. I bet you he's vaping, just based on the way it's coming out. Smoking, vaping, other tobacco uses, we know these things have major problems. We know they cause absenteeism. By the way, that little stat at the bottom of the page there, on average, smokers take roughly 6 days of smoke breaks every year. That's time they're not on the job. That's time that somebody's covering their shift for them. That's a more likely scenario where we're going to have an accident. And the very fact that smokers, tobacco users, heavy drinkers have to go to the hospital more often, have to miss work. Again, when I have someone else driving your truck, covering your shift, doing your work for you, that's not as used to that job, maybe hasn't been trained as thoroughly on it or hasn't done it in a while, I have a bigger safety risk. And so to the extent that your program can help people get off using tobacco, obviously the company is going to benefit as a whole. And just low morale. This comes back to the culture side of things, but having low morale and high turnover, again, puts pressure on safety in huge ways, right? So 62% of engaged employees feel their work positively affects their physical health. Are you in that category? And can you grow even higher in that category? You want people who go to work to do so because they love it, or they at least enjoy it, and they have friends on the job and they feel recognized by their boss and what have you. And so that's all part of improving morale and driving culture. And part of, again, that strangely doesn't really sound like I just talked about safety, right? Talked about people being happy on the job and having higher morale. That's a safety issue, and that's an engagement issue, and it's how it all ties together. So just to paint sort of a picture for you of how these things come together and other things like them. And again, there are a lot of HR professionals on the line here as well today who may be more in tune with that wellness message versus the safety message. But I would say that if I worked for a really large industrial company or vehicles on the road or anybody, construction, anybody in that area where safety is so important, I would just say, let's put HR and safety and risk and other managers in the room and say, we have these things that will jointly benefit us. How do we go about them? And so the hub, really the center of this wheel, it doesn't have to represent it as a computer, but it's the center of engagement. And you can see how safety and wellness and peer-to-peer recognition, manager spot awards, retirement programs or service awards, all of these different things, sales incentive programs, all of these things. I mean, very often the sales team is also the guy who's calling on a convenience store, wheeling in a pallet full of food and setting up an end aisle display. And he's also the sales guy. And he's very much the responsibility of the safety manager, right? So all of these things come together rather than having siloed departments running their own programs and doing so on their own budgets without getting the economies of scale. You're far better off starting to look at it as a holistic solution for employee engagement. Okay, I'm going to wrap up fairly quickly here because I want to leave at least a few minutes for some questions. So I'm going to do this very quick. So keys to success. And these come from self-serving comment here, but from companies like my own that help build these programs, right? There are missteps along the way that companies make. I saw a couple of questions in the chat box that speak to some of those about selecting awards and how to offer value in the program. And those are the things you'd expect companies that do this for a living and have now, at least in our case, for 45 years to be able to address. But the first is you need manager influencer support, C-suite, top level, and every level along the way. And the way you get the high-level managers, the C-suite, to really take notice is you show them that first graph I showed you, which talked about top 25% in employee engagement is going to put us on a much greater path to profitability, super high return on investment, whether it's 3.3 to 1 to Dr. Mel's point on some of those specific stats or 4 to 1 or greater. That's how we're going to actually save money for the company, become more profitable, retain our customers. And so that should catch their attention. And also the C-suite folk always love to be on the list of best places to work and most engaged companies and what have you. And so getting on some journal's list of best places to work or most highly engaged workforces would puff up their chest as well and get their buy-in. But you got to get buy-in from those people. Otherwise you can love it and just have it swatted down before it ever gets off the ground. Recognition, rewards programs, individual versus group recognition. It's the structure that we're talking about here. The structure of these programs is crucial. You can have a great concept, a great idea, you can get everything else right, but make one mistake in the way you're rewarding people. And just by way of example, is really on the safety side, you should communicate the group goals, but reward the individual behavior. On the wellness side, it's perfectly fine to reward both the individual and the group behavior. And that small nuance may seem small, but if you got everything else right and that wrong, you debased your program. So you have to know the best way to build them and where the pitfalls are. Positive reinforcement only, okay? You have plenty of ways of punishing your workers if they do things wrong. You can put them on a PIP. You can reprimand them, you can fire them. The engagement programs, the employee recognition reward programs are strictly positive behavior, positive feedback, and that's the way we go. We're trying to encourage positive behavior by reinforcing and rewarding that positive behavior and building muscle memory. The expanded reach is really what I was talking about on the last slide, which is that, sure, you launched it as a safety program. You can strengthen it by adding in wellness, peer-to-peer recognition, manager spot awards. So find ways to expand the reach of your program. Face-to-face recognition can't always be done. Remote workers, irregular, truck drivers that drive irregular routes, or it's just not convenient to physically hand people point vouchers every time. Perfectly okay to reward them electronically when you need to, but when you can, when Jane Doe makes the best suggestion in the safety meeting, to go out and recognize and reward Jane Doe in front of her peers for that, or the top wellness participant, that has a powerful effect as well, and a knock-on effect for the people that witness it. Benchmark and measure your results. It's something ridiculously small. Less than 25% of companies that launch these programs do a good job or any job measuring the results. People like myself and our company, we're screaming from the rooftops saying we can measure everything we can measure internally. We also need data from them, and we can cross-pollinate the data to come up with some really, really interesting reports about how turnover reacted at a time where your engagement scores were going up. Obviously, expect turnover to go down when your engagement scores were going up, when people were feeling more recognized, but take the time to prove that, gather the information to do so. And a comment about patience is strictly what I was alluding to a bit earlier. Return on investment is investment first, return later. These programs take 12 to 18 months to ramp up before you really see results. You have to know that going in. It's just logical if you think about it. But once you have enough momentum behind you and you're starting to build that momentum and getting people that muscle memory and getting people reinforced, you will start to see the results. It doesn't happen in the second month of the program. Okay, generally takes a year to 18 months before you'll start to noticeably see incident rates falls and severity rates falls on accidents and injuries or health increase. And then you start to get the benefits of reduced insurance payments and reduced workers' comp claims and what have you. Okay, and the last four here, I'll talk about on the next slides. The first one is tangible rewards. Again, if you've heard me before, you've said, I've heard this guy say this before, and I have, and I will say it every day I do this job. If you build a program, if you build a perfect program, as explained in this webinar, and launch it, and your rewards are cash or cash-like items like gift cards and gas cards, you're just lighting money on fire. Anybody, if you ask all your workers, what do you want? They'll all tell you cash, but what do you want? You want them to change their behavior for the better. You want them more engaged. You want to have a better culture. You want better morale. You won't get that with cash. You really won't. You have to adequately compensate them to begin with. And I start from the basic understanding that hopefully you are paying a market rate for your workers. But beyond that, what we're asking them to do on the safety and wellness side, what we're asking to do to break through the clutter of everyday life and gather their attention, requires that the reward itself is memorable and tangible, okay? And that barbecue grill, that Weber grill in your backyard, that Keurig coffee maker, that Fitbit, that Sony TV, those items in your possession, the golf clubs, okay, and the fishing poles, those items, for as long as you have them, you're going to tell your neighbor when he's standing there watching you barbecue on a grill, I got this grill for being a safe employee, okay? And that's the connection point, okay? If you put it in their paycheck, if you hand them a gas card or a gift card, same thing, they're going to forget they ever got it. You're not even sure that they're the ones who are going to use it. You don't know what they're going to redeem it for, and there's no memory value. So do not use cash as your reward vehicle. And this is just a slide that sort of highlights, probably 1/100th of the brand names of the tangible products that should be in these programs. Like I mentioned earlier, submit your questions or your comments. You got about 5 minutes to do so. You got a chance of winning a Bose Bluetooth speaker, a DeWalt tool set, or what have you. I'm going to pull an award winner in the days after the webinar and give one out for the best comment or question, and it's going to be a tangible reward. And the last couple of points, and I am running long, so I'm going to do this real quick. Technology is your friend. I'll just leave it at that. If you're the type that laments some technology in the world, I get it, but I would look for the good in what technology can do. It can clearly do a lot of bad, but in all of these technological advances, there's things that can make your program stronger and better, and ask for help in figuring out how to do that, because it's a one-way street, and your workers are going to keep using it, and your millennials are going to use it even more, and you want to make sure you're using it to the best of your ability. And the last 2 points are really one point tied together. You need to put a brand name on your program. and you need to promote it like the powerful, valuable brand that it is. It's not your safety program. It's not your wellness program. Put your name on it, put a custom name on it, promote it on posters, catalogs, flyers, vouchers, websites. Again, a good partner is going to help you do this and do it well. But for the same reason that Coca-Cola keeps advertising its product when everybody in the world knows what Coke is, they continue to advertise their product because there's strength in that brand name, and that brand name continues to lead to sales. They know this for a fact. If they pull their advertising in Atlanta or Boston or New York for a month, they see a drop in sales. So it's a brand. It needs to be promoted that way and protected that way for maximum benefits. And so with that, I will stop, hand it back over to Benita, who will ask us at least a couple of questions in the short time we have.
Thank you, Brian and Tyler, for a great presentation. Before we have our presenters address some questions that have been submitted throughout the program, I just want to remind you that we'd love your feedback in our webinar survey to help improve our program. So for our first question, Tammy would like to know, so my question about how to choose meaningful rewards has a deeper level of distrust from the line employees. They feel like management is not transparent and talks the walk, but does not walk the walk. In past years, reporting incidents got employees in trouble, including near misses. We've been working on changing that perspective, but some of the old timers are still there and still use punitive means. How do you get them to change?
Yeah, so oh my God, this question alone could take me the next 4 minutes, but in the shortest version I can give it, and Dr. Mel, feel free to jump in. It's a heavy lift. I'm not going to lie to you. What you're hoping to do is nudge it forward month by month, year by year, over a period of time, and it will work itself out. It will be worked out through the process, but you can't give in to the negative Nellies. I don't know where I get that from, but so first of all, you can give people the ability to report near misses anonymously if that makes them more comfortable in doing so. One small way of doing it. It's certainly far better to let them report it in a way that maybe even bypasses the manager. So if you have an older crowd and they're in that managerial position and a lower level worker reports a near miss to that manager, and it might be some punitive action as a result of it, by having a well-built recognition rewards program, you can have survey and quiz tools built right into the platform. And as a result, if I want to submit a near miss, it can go directly to safety or HR, and it doesn't have to be seen by my manager. And in fact, I can even use that tool to say that somebody can say, listen, I just want to report a safety hazard. Every time I tell my manager there's a problem, he gets mad at me and tells me to shut up. So you do have the ability within the tool, within the platform, to get direct feedback from the field that you might be less likely to get in a situation where you normally ask the managers to go ask the employee something and then have it filter back through the managers to you. That's one small tip. But Tammy, beyond that, I'll be happy to take your question offline and try to work with you to get you to a better place and on the right path. And Dr. Mel, anything to add to that?
No, I don't. I think you did a great job responding to that, Brian.
Thank you. So next question, Benita.
Okay, great. Next question. Yep, next question. It seems knowing why we are in business will lead us to ask questions on productivity, engagement, and health. Answering why questions help us connect and excel. Actually, that appears to be a comment rather than a question. I apologize.
Yeah.
Next question.
Yeah, okay.
How would you best describe? Oh, sorry. Go ahead.
No, you go ahead. It was a comment. I agree with it, and I'll be happy to send some feedback to that comment in the response. But why don't you get to one more question if we have time for it?
Yep, sure. How would you best describe the concept of engagement to the average worker, especially millennials?
Was it how would you explain?
How would you best describe the concept of engagement?
Oh, okay. Well, I would start with this. First of all, millennials, if you do it right, if you do it wrong, the millennials will look at you, with a sideways look as well. But if it's done right, nobody's going to get this better than millennials. Millennials grew up in an age where recognition was handed out in every aspect, including virtual. There was a toy a long time ago called Webkins. Don't know if anybody remembers that. But if you gave your kid a Webkins toy and he went online and plugged in the code, he could start doing things and earning points, and those points were redeemable for prizes. And so some sort of recognition of a job well done is something that is far more inherently acceptable in the millennial world. I mean, it's also, and there's movies made about this. I mean, you expect to, the minute you buy something, there's a 5-star thing pops up in front of you and you want to get feedback. Millennials need, and this is it's a, it's a, stereotype for sure, but it doesn't mean it's not accurate. They need and want and crave feedback. So a millennial is less likely to go into a job where they'll walk to the door, say, congratulations, welcome to the company, and there's your cubicle, and there's no interaction. They need interaction. And that positive interaction that draws them towards doing things the right way over and over again, because they get positive feedback every time they did it that way, and not being ignored for 6 months or 12 months and just being told what they did right or wrong at a review period. That's what they need. And really, it's true of all employees, but I think it's more true of millennials. And hopefully I addressed that.
Thank you. And that is all the time we have. That's all the time we have for questions today. Please join me in thanking Brian Galonick and Dr. Tyler Imal for their presentation, as well as our sponsor, Allstar. If you have any additional questions or comments, please don't hesitate to click the Email Us button on the console. Webinars.ishn.com for the archive of this presentation, as well as information about our upcoming events. We appreciate your time and hope you found this webinar to be a valuable experience.